Welcome to HealthFlex Insights, where great care costs less. I'm your host, Allison, and today we're diving into how companies can dramatically reduce healthcare spending without compromising on quality. Joining us today is Dr. Ben Park, the co founder of HealthFlex and a pioneer in the field of healthcare management. HealthFlex's innovative FlexxCare system has been revolutionizing employer healthcare programs by pinpointing savings opportunities and enhancing service delivery. Today, Dr. Park will share insights into their process and how it can benefit your business.
Thank you very
But,
much, Allison.
all right, so I've got a bunch of questions for you, and I'm just going to dive right in and start with the first one that everybody wants to know. So, Dr. Park, could you start by telling us a little bit about your background and what led you to co found HealthFlex?
Sure, I am a physician and a computer scientist by background, and I worked for American Health Network. Actually, was one of the founders of that, and then we sold that to Optum. And at Optum, I ran the Midwest for them, where we had really good results in our managed care programs, primarily through increasing quality, which lowered our cost. Great care costs less, and so that got me thinking about how could I do even more of that. So I went and I started HealthFlex, and we began building tools to help improve healthcare quality.
Can you explain what FlexCare is and how it differentiates from other healthcare consulting services?
Sure. I mean, we start, like a lot of people do, with claims analysis. But from that claims analysis, we determine a couple of things. Are there opportunities to reduce costs by picking less expensive, high quality providers? Number one. And then number two, what can we do to improve the medical care that people are getting? And if you look at hypertension, which is the cause of heart attacks and strokes and many other illnesses, it is not well controlled. 39% of the people in the United States with hypertension are not under control. I know it's possible because we did it at my previous company to get up to 85% of patients under control. And that makes a huge difference in the side effects and the problems that those people have.
Absolutely. All right, well, let's delve into the FlexCare process. How do you begin the process of analyzing a company's existing healthcare data, and what are you looking for?
We're looking to see if there's a area of focus. Do they have a lot of people with hypertension, a lot of people with diabetes or obesity? And then we design programs around that. Uh, the programs not only support good medical care, but they also support changing behavior. If you look at the impact that medical care has on your health status, it's actually very low. It's only responsible for about 11% of your health status. Your behaviors are responsible for 38%. You spend about 60% of the dollars on medical care and about 5% of the dollars on behavior change. So we focus on shifting some of that money from medical care by doing a better job of it and helping people change behaviors, which will have near term and long term impacts on cost.
That's amazing. We need more of that. So, after analyzing the data, how do you identify and prioritize opportunities based on ROI? Could you give us an example of what this might look like in practice?
Yeah, typically what we'll find is that one of the things when we're looking at the cost of the providers, we'll focus on outpatient surgeries because they account for about 20% of the medical spend. And it's pretty easy business to redirect to lower cost facilities. So at 20% of the total cost, we can usually cut that in half, which results in a 10% savings in overall medical costs. That's the typical first kind of low hanging fruit that we go after.
Selecting opportunities based on ROI is crucial. So, can you discuss how you ensure these opportunities will yield a high return on investment?
Sure. The other things that other than just reduce cutting the cost of the outpatient surgery is we focus on reducing the cost of diabetes and hypertension and obesity and all of these other chronic medical problems, which end up costing people a ton. If you look at this, the one lawyer who recently went to a 3-day trial, and while there, forgot to take her medications for hypertension, thinking it wasn't that important. Ended up having a stroke. Ended up losing the vision on the to the left, the hemianopsia. So she could no longer drive, has difficulty reading. The personal cost was huge, but the medical cost was also a couple $100,000 that could have been avoided if she had been monitoring her blood pressure, because she would have known that it was going up and could have taken action to get another prescription for blood pressure medicine while she was in the trial.
Implementation is key in any strategy. What are some challenges that companies face when implementing new medical services, and how does HealthFlex assist with these challenges?
We try to stay outside of the medical system. We are monitoring patients who have illnesses, and I'll use hypertension again because it's easy to illustrate. We have those patients take their blood pressure reading every morning, and we notice changes in that. And we send a letter to the patient monthly, talking to them about how well controlled their blood pressure is or not. And we send a similar letter to their physician. So it's highly motivating for a doctor to get a letter from a monitoring service saying, "Hey, your patient Sandy, her blood pressure is uncontrolled, and she's at risk for strokes and heart attacks and other things. It You might want to consider an adjustment." So we utilize the existing medical system without having to build another system, which is the approach that I think a lot of other people take. So we use the tools of behavior change, behavioral economics, and functional imagery training, reframing, gamification, all of these things to nudge people, physicians and patients, towards healthier outcomes.
Sounds simple, and it's a win win for physicians and patients alike. Moving on to chronic disease management and progressive screening, how do these elements fit into the cost saving strategies you recommend?
Well, the chronic diseases, you have to do two things. You have to manage them well so that they're not causing additional healthcare cost. And you have to address the root cause, which is activity, diet, sleep, um, the relationships. Those are the things that are really important. If you look at there are five factors really that are important to health outcomes and longevity, and we address all five of those.
Contract negotiations can be complex. What strategies does HealthFlex employ to ensure favorable terms for your clients?
Well, we look at where they're spending their money, and surprisingly, what we find, particularly in places that have a younger set of employees, is that on a per encounter basis, um, obstetrics is the highest cost item they have, even exceeding cancer. I just looked at one the other day where it was $15,000 per person that they were spending on obstetrical care, and only 12,500 on cancer treatment. So that there is an opportunity there, and hospitals don't advertise it, but if you go to them and negotiate and are willing to pay the normal delivery fees up front, they'll give you a discount. And
Hmm,
so we lead our clients through that.
interesting. I feel like that's something everyone should know. We need to get the word out. Finally, how do you measure the performance of the implemented strategies, and what steps do you take to fine tune them based on the outcomes?
We're all, you can't manage what you don't measure, and so we measure everything. So we know how well controlled the diabetics are, how well controlled the hypertensives are, how much emergency room utilization they have, and so we focus on the areas that need focus, and typically it will be diabetes, obesity, and hypertension. But there are other things too, and we don't do the medical care. We nudge the medical care providers and the patients towards behaviors that are more compatible with health and longevity.
That's great. All right. Well, looking towards the future, how do you see the landscape of employer healthcare evolving, and what role will HealthFlex play in this evolution?
I think that increasingly employers are going to take an interest in it because they're they're the ones that really care about cost and quality. If you think about the insurance industry, um, they care about it, but not as nearly as much. If they basically the way the insurance industry works in healthcare is they keep 15% of whatever you spend. And so if you think about that and you get 15% of the pie, do you want the pie to be smaller or bigger? And so there's a little bit of a conflict for insurance companies in representing their clients. So we help them to an extent um, take on some of the roles that may have historically been insurance company roles, like negotiating for the price of obstetrical care or improving the quality of chronic disease management, those kinds of things, and disease detection. We do an annual wellness visit with people where we do blood tests and take vital signs and put that into the whole mix.
That's wonderful. I want to sign up right now. All right. Well, Dr. Park, thank you so much for sharing these valuable insights. I think it's clear to everyone watching that HealthFlex is not just changing how companies manage healthcare costs, but also ensuring that employees receive the best possible care. That's just obvious through this conversation with you. Make sure that you stay tuned for more episodes of HealthFlex Insights, where we will continue to explore how smarter healthcare can lead to substantial savings.
Thank you, Allison.
All the best.